EVOS presents स्वास्थ्य संवाद एवं कनक न्यूज द हेल्थ कॉन्क्लेव 2023 को-पावर्ड बाय यूजेनिक्स हेयर साइंसेस एवं कमल वॉच को सिंस 1969 प्रेजेंटिंग स्पॉन्सर EVOS को-पावर्ड बाय यूजेनिक्स हेयर साइंसेस kamalwatch.co since 1969 supported by Apollo Hospitals Touching Lives, Kalinga Super Speciality Hospital, Amri Hospitals, a joint initiative by Swasthya Sambad एवं Kanak News.
And now, ladies and gentlemen, we have a special session by Dr. Bidyut Das. Before I speak a few words about him, I'd request all of you to please feast your eyes on the screen for the AV. Can we please have the AV for Dr. Bidyut Das?
प्रोफेसर डाक्टर विद्युत दास राज्य तथा देशर जने सुनामधन्य डाक्तर कटक बड़ मेडिकल रो रिउमाटोलॉजी विभाग मुख्य गरीब और अवहेलित वर्गर रोगी से केवल डाक्तर नुहंती से जड़े देवदूत तांकरी उद्यम रे कटक बड़ मेडिकल रे रिउमाटोलॉजी विभाग गठन होइथिला। टेलीमेडिसिन सेवा जोगाई दूर दूरांतरु हजार हजार रोगी मुहरे से हस फुटाइछंती। टंका रोजगार लक्ष्य न रखी रोगी सेवा को प्राथमिकता देई थांती। सरकारी डाक्तरखाना रे से रोगी देखंती, घरोई प्रैक्टिस करंती नहीं। अर्थर कोनोसी लोभ न रखी तांकर उत्सर्गीकृत रोगी सेवा अन्य डाक्तर मानकु मध्य आश्चर्य करिथाय। डाक्तर दास को दीर्घ दिन कैरियर भितरे हजार हजार गरीब रोगी मागणा चिकित्सा पाई उपकृत होइछंती। जणे भल डाक्तर भाबे से जेतिकी जणाशुणा चिकित्सा शास्त्र रे जणे उच्च कोटीर गवेषक भाबे रहिछि सेतिकी ख्याति। तांकर 40 रु अधिक संदर्भ जातीय और अंतर्जातीय मेडिकल जर्नाल रे प्रकाश पाई उच्च प्रशंसित होइछि। अनेक सम्मान रे सम्मानित होइछंती डाक्टर विद्युत दास।
And now, ladies and gentlemen, I'd like to invite none other than Dr. Bidyut Das on the stage for his special address to share his precious life experiences with all of us.
Thank you very much, Sambad Group, for inviting me. Greetings to all the dignitaries of attending this session today. I was told that I'm supposed to deliver a lecture on a topic which I didn't know, which I was not given a topic. So I thought I will just cover a little bit of my experience in the last 38 years. I worked entirely my entire life in a government medical college, that is SCB Medical College. So in 38 years, I've done medicine, a lot of infectious disease, then I switched to immunology, then I went to rheumatology. So it has been a big journey for me. And obviously, as a teacher, as a physician, consultant, researcher, I've seen a lot of change that has occurred in the health field in the last 40 years. The first thing that we see is the dramatic changes that have come about in health. Longevity itself has become almost 70 years when it was only 40 years. And this is the result of excellent medical facilities that we are providing to patients. Technology has advanced in leaps and bounds. The technology that we see today is unbelievable. Infectious disease was the main concern of most people. The Western society has almost wiped out infectious diseases through three important things: sanitation, vaccination, and antibiotics. And we are still grappling, the developing countries are still grappling with infectious disease. We do have lots of infectious disease. And you see COVID came as a big surprise for everybody. The second thing that we face is now non-communicable disease, for which the technology is huge. Imaging is one. You cannot think of early diagnosis without a scan. We have MRIs, we have PET scans, all kinds of scans. And of course, the higher concepts, that is genetics, that is called precision medicine. You can find out the defect in a person and you can pinpoint the genetic fault and target it. That's possible now. And we have a technology called CRISPR, which is called gene editing. You can edit the gene and you can produce healthy babies. That brings to question, are we training our doctors well? Are we producing quality doctors? What is the problem with our training? Are we faltering? Now in India, there are around 612 medical colleges in this country, 1,000 undergraduates, multiple postgraduates, almost 24,000. But one thing that has happened, as Dr. Guleria said, the concentration has gone away from clinical medicine to investigative medicine. As I demonstrated in this case, that investigation did not provide him with a diagnosis. It was simple clinical examination that gets diagnosis. There was a gentleman called William Osler. I don't know, my younger friends, doctor friends might be knowing. We consider him to be the father of modern medicine. What did Osler say? And I follow him very meticulously. I belong to the old school. I teach my students, I tell them we belong to the dinosaurus age, but we believe in combining modernity with a tradition. William Osler, he gave 5 principles. He said a good doctor is one who uses all his senses, observes, takes a good history, does a good examination, allows the patient to give the diagnosis. You don't have to do much. Allow the patient to give his diagnosis. And medicine is learned at the bedside of the patient, not in the tutorials. Today you must have heard about doctors, most students going to the tutorials to crack the MCQ exams and then get into MDs and DMs. The result is we are losing the art of medicine. Is clinical medicine become obsolete? Can never become obsolete. You have to combine it. You have to understand. That's exactly what has happened. William Osler is no longer followed. I don't see a patient who doesn't come with a MRI. Ordinary imaging has gone out of the door. Any backache has an MRI. Any headache has a CT scan. These are the kinds of patients we see. So are we making a mistake in training our doctors? Are doctors losing a sense of feeling for the patient? So this is where the teaching has to change. I think we have to make students more practical, more clinical oriented, simultaneously teaching them the new developments that have occurred in the different technologies. Come to patient care. Of course, I've spent all my time in a medical college, which is a government college, and we see thousands and thousands of patients. The patient load. Unbelievable patient load. And these are patients who come from rural areas. They are poor and low middle class. Most of them are poor. They cannot afford medicines. But the brilliant thing that has occurred in Odisha is everything is free. Government provides everything, including dialysis, transplantation, cardiac surgery. Everything is free in the medical colleges. Patients come, they are poor, they have to be told, they are ignorant, they don't know where to go and what to do. There are so many specialities. I created a specialty called rheumatology. Till now, not many people know what is clinical immunology and rheumatology. Till now, people come and say, sir, are you the professor of orthopedics? I said, no, I'm not. What does rheumatology deal with? What is immunology? So that ignorance level is still high. It took me almost 22 years to establish the Department of Rheumatology. And you won't believe, this is only the 6th state-funded medical college that has a department out of 322 in this country. Only the 6th. Imagine how much the patient benefits when they know that there is something like this. Patient care is important, provided, as Dr. Guleria said, you have empathy. You need to have touch with the patient. The patient has to feel that you are connected with him. Trust. Most of my patients believe in my trust. They have to come one night before, they stay overnight to get a ticket. And they sit till 10 o'clock, 8 o'clock, how long I stay there. And they say, we want your touch. That faith is very, very important, which is missing today. Patients don't trust us. Patients don't trust doctors anymore. They're always thinking that there is something wrong. And that is what we need to bring back to the system. The trust and that touch. The healing touch, which is missing. Many patients come to me, sir, you touch us, we'll be fine. Faith, belief. I have touched hundreds of people. Sometimes I feel I've become a spiritual man or something. I touch them, yeah, you go back, you'll be fine. That touch has to come back. And the belief has to come back in the patients. And of course, finally, quality research. We know what research we do, what kind of research we do. And this research has to be directed at tropical problems that are necessary for our state, for our country, and it has to be local. We don't have to chase the Western dream most of the time. We do. We try to imitate what the Western guy has done. We do a research. That research has to be focused on us. And unfortunately, research is something that is rarely taught or done in medical colleges. Now, I'll end my talk with one example. I follow these people. Dr. Bhang, Abhay Bhang and his wife. They are two qualified pediatricians who work in Gadchiroli, Maharashtra, in the Naxalite-affected areas. They came back from US and they started practice inside the jungle, in one of the dense jungles. They were awarded the Padma Shri 2 years back. And the amount of work they have done to decrease infant mortality in community service, you don't need high-tech stuff to do good things at the rural area. We need to do that. Our rural areas are badly neglected. We don't reach out. We don't do simple things they did, very simple things. And they transformed the scene, completely transformed the concept of what is called infant mortality. They reduced it drastically in such a small area. Which means it's possible, we can do it. That last mile of service can be provided, I believe in one thing, that's called telemedicine. I've been an ardent supporter of telemedicine for the simple reason that I saw hundreds of patients are dropping out because they need monitoring and they can't come back. People coming from Kalahandi, Koraput, once they come, $15,000 they have to pay. The per capita income is so low, they say, sir, it's impossible for us to come twice. I started telemedicine service. We have an excellent telemedicine center at SCB Medical College. 2015, I started it. And I have covered 22,000 consultations till now. 22,000 consultations. Patients don't come. They stay there, come to the district headquarters hospital. We have 30 districts. They come there on specific days. I see them. I've seen them earlier once. For follow-up, I use telemedicine. And telemedicine is going to be the answer for a lot of maladies that we have in taking healthcare to the rural areas and to the difficult terrains in the state. In COVID time, a lot of patients would have died without tele. We did WhatsApp. 6,000 patients I covered in WhatsApp. Sitting at home, they talk to me. And some of these immunological diseases are extremely difficult to treat unless you talk to them face to face. How much money did I save for the patient? 5.5 crores. This is the amount of money I've saved. There are simply 4 things we need to know. We need to have that clinical touch. The training has to be quality. The treatment has to be with empathy. Research has to be focused. And the last mile has to be carried by telemedicine. Thank you. Thank you very much.
इवोस प्रेजेंट्स स्वास्थ्य संवाद एवं कनक न्यूज द हेल्थ कॉन्क्लेव 2023 को पावर्ड बाय यूजेनिक्स हेयर साइंसेस एवं कमल वाचको सिंस 1969 प्रेजेंटिंग स्पॉन्सर इवोस को पावर्ड बाय यूजेनिक्स हेयर साइंसेस kamalwatch.co since 1969 supported by Apollo Hospitals Touching Lives, Kalinga Super Speciality Hospital, Amri Hospitals, a joint initiative by Swasthya Sambad एवं Kanak News.